Welcome, everyone. We are delighted that you have joined us today for a discussion of this important topic, mandatory reporting of human trafficking. I am Abigail English, a member of the HEAL Trafficking Board of Directors and chair of HEAL Trafficking's Advocacy Committee, and I will be moderating today's webinar. I will be joined by two outstanding panelists, Tonya Chaffee and Jonathan Todres, whom I will introduce in a few minutes. Please note that this webinar is being recorded and a link to the recording will be released after the webinar as soon as possible. First, a few technical issues. All participants are muted. Please use the chat box to ask questions or to chat during the webinar. Use the chat box for any questions that you would like to pose to the panelists, and I will be sure to convey them during the Q&A session. If you have technical challenges, there are some numbers on your screen for calling Zoom support, and we will reserve about a half hour at the end of the webinar for a Q&A session, and we anticipate a lively discussion. First, I'd like to introduce HEAL Trafficking. HEAL Trafficking is a nonprofit organization that is building the capacity of health professionals and health systems to respond to human trafficking. HEAL Trafficking was founded in 2013 and now comprises a network of more than 3,500 survivors and multidisciplinary professionals in more than 35 countries. HEAL Trafficking approaches human trafficking through a public health lens. We see ourselves as a centralized resource for the healthcare and public health communities on trafficking and as a resource on health for the anti-trafficking community. Our public health response to human trafficking involves coming together to expand the evidence-based and trauma-informed care response, enhance collaboration among multidisciplinary stakeholders, educate the broader anti-trafficking, public health, and healthcare communities, and advocate for policies and funding streams that enhance the public health response to trafficking and support survivors. Our network includes leaders from public health, international health, academia, government, clinical practice, including physicians, nurses, advanced practice clinicians, public health professionals, psychologists, behavioral health professionals, social workers, as well as researchers, attorneys, and administrators. HEAL works through an active committee structure that includes education and training, direct services, research, protocols, and advocacy. The Advocacy Committee is the host of today's webinar. If you are interested in becoming active in any of HEAL's work, you can sign up at healtrafficking.org. So let's turn to the topic of today's webinar. We are privileged to have with us as panelists today two leading experts on human trafficking from a public health perspective. They are also experts on mandatory reporting. I had the pleasure of serving with both of them on the Institute of Medicine's Committee on Commercial Sexual Exploitation and Sex Trafficking of Minors in the United States. So I know from firsthand experience how fortunate we are to have them join us today. Tonya Chaffee is clinical professor of pediatrics at the University of California, San Francisco, medical director of San Francisco's Child and Adolescent Sexual Abuse Resource Center, and director of the Teen and Young Adult Health Center at San Francisco General Hospital. She's involved in research, policy work, and advising of non-governmental organizations on youth violence and she works actively with San Francisco Bay Area human trafficking initiatives. Jonathan Todres is Distinguished University Professor of Law at Georgia State University College of Law. He's engaged in research on children's rights and child well-being, child trafficking and exploitation, human rights, and the social determinants of health. He is a member of the Board on Children, Youth, and Families of the National Academies of Sciences, Engineering, and Medicine. Rather than offering serial presentations via PowerPoint, for the next hour, Dr. Chaffee and Professor Todres will respond to a series of questions designed to illuminate an issue that presents ongoing complex concerns from a legal, ethical, and clinical perspective. I am confident that we will understand these issues better at the end of the webinar than when we began. Remember, if you have questions for the panelists, please enter them in the chat, and I will make sure we get to as many of them as possible later in the webinar. So now let me turn to our panelists and begin our discussion. Let me start with you, Jonathan. What is the basic legal framework for mandatory reporting related to human trafficking?
Thank you, Abigail. And I want to thank Heal Trafficking for hosting this webinar. I want to take a step back. I suspect many of the people on the phone are experts in human trafficking, but there may be people who are newer to this issue. And I want to just contextualize where mandatory reporting occurs. So let's start with the definition of human trafficking briefly. As many of you know, it has three elements: an act, means, and purpose. The act can be recruiting, harboring, transporting, obtaining an individual. The means would be through force, fraud, or coercion, although there's an exception to that, which is relevant today, because you do not need to establish force, fraud, or coercion when a minor is the victim, because under law, minors cannot consent, so there's no need to prove that they were forced. The third element is the purpose, which is exploitation. And that can be in a range of sectors: construction, mining, hospitality, the sex industry, and so on. And it's that third element where mandatory reporters come into play. So I think it's important to sort of recognize that broader context. This is really about a sort of, ideally, an early intervention or an intervention strategy when people are at risk or harmed through human trafficking. And it's that's the element where it comes into play. So with that background, let's talk about sort of the 30,000-foot view of mandatory reporting of human trafficking. First, it builds on a pre-existing system, as many of you know. It builds on the mandatory reporting system that exists in all 50 states for child abuse and neglect. And not all states have extended this to human trafficking. Of the states that have extended their mandatory reporting laws for child abuse and neglect to human trafficking, most have extended it to both sex trafficking and labor trafficking, but there are a number of states that have simply expanded the definition to include sex trafficking and do not include labor trafficking. In terms of who is covered, again, that is a state-specific issue. Each state in their state law has a list of who is a mandatory reporter, and there are common ground, notably healthcare professionals in many settings, teachers and other school personnel, but there are also varieties, there are variations across different jurisdictions based on the specifics of that state. In terms of what is required, if a person, as many of you know, who are mandatory reporters, I suspect many mandatory reporters are on the phone today, what's required is if there's a suspected case that you have to report that, and that reporting requirements, again, can differ. So sometimes it is reporting to Child Protective Services or the equivalent in that state, sometimes law enforcement, or one or the other. And so there's lots of variations across states, and I think we should be aware of that. I think primarily today, we are going to speak generally and then pull out illustrative examples from different states as we go along. So let me stop there. I think that's the sort of basic lay of the land, and then we can sort of move to more details and critiques and what's working, what's not.
Great, thanks, Jonathan. I'm gonna stay with you for a moment and just ask you to talk a little bit about what are some of the overall goals of mandated reporting laws, both generally and also specifically for human trafficking.
Right, so the most sort of the high level plan and goal is to stop abuse or stop harm from occurring, right? And again, if we think about sort of the different elements of human trafficking, where this is typically intersecting is when some harm has occurred already, right? There's suspected abuse, there's signs of abuse, or there's signs of exploitation, or signs of harm that occurs through human trafficking. The idea is, as many on the webinar know, to identify those individuals who may be at risk of harm through human trafficking and remove them from those harmful situations, and link them also to services that they need to address the harm that they have experienced. The second sort of goal and sort of articulated goal that you often hear around mandatory reporting is what we want to do is incentivize, or not really incentivize, but insist that those who have a chance to stop harm from occurring, particularly when children are involved, they don't look the other way. And so I think that's been a driver. We through mandatory, those who work on human trafficking are trying to do is identify where are there opportunities for intervention. How do we insist that, how do we ensure that those people who are in position to do something actually do something? The last thing that's talked about a little bit less, but I just want to mention is data. Tracking of what's happening, understanding the problem is important. When mandatory reporting happens, we have a better sense, and when it works well, we have a better sense of the scale of the problem in a particular jurisdiction. And so that is also important for at a policy level, in particular, when we think about where and how do we allocate funding and other resources to respond to the problem.
Thank you, Jonathan. Tonya, from a clinician's perspective, what do you see as the goals of mandated reporting?
Thanks, and I want to also thank Heal for this webinar and for all those participating or who are listening later on. From a clinical perspective, and I think this goes back to sort of when these laws were initially created, and I'm a pediatrician, so I'm very well aware of sort of the child abuse reporting requirements. And that was, as Jonathan pointed out, to really identify and potentially help people who may be at risk to sort of stop abuse. And so mandated reporting laws have been expanded, as many people know, to other areas, including in like domestic violence or intimate partner violence. So it's really trying to help from the clinical perspective, have that other awareness, or what we kind of talk about is that it's something that's in the differential diagnosis when something isn't making sense. And in my profession, it's kind of one of the bread and butter areas that we learn is how to do that. How does that happen clinically? And that, you know, when you go and sign up in any hospital organization or, you know, system of care, the first thing you do is sign off on, you know, that you are a mandated reporter and you will do your obligated duty to do that. In the area of human trafficking, as Jonathan sort of pointed out, there, you know, each state has different kind of ways that the laws are written. And sometimes there can be overlap in those areas, and it can be a little confusing for health professionals. But I think the overall goal is that we want to help people and get them the services that they need, knowing that as a mandated reporter, we are obligated to do it. I think one of the areas, and it's not necessarily the goal, but is more of a stick than a carrot, is in our healthcare system, we don't want to be liable if we don't report. So sometimes in the world of healthcare, we get a little worried if we don't make that report because our risk management people are kind of like hovering over us, like you need to do this because you could be liable if you don't. Not that that should be the motivation, but unfortunately in the healthcare world, that can sometimes be a driver for how things are done. With what I also see that should be an overall goal with mandated reporting And in the area of human trafficking, it's to do one of those arms in public health of sort of helping us either identify a person who's actively involved or someone who may be at risk. And that can be a gray area of who's at risk. But also more importantly, to ensure, and I call it sort of the cart before the horse. It's one thing to have these laws in place, but it's another thing if you don't have the response that meets the needs of the individual. And we'll get much more into that as we go along. But that's sort of what I feel should be the overall goal, is to really have the cart and the horse together. In other words, these laws, if they are in place, have to have a robust response that doesn't always necessarily involve the two prime agencies that Jonathan spoke about, child welfare and law enforcement. Maybe that should be looked at more broadly. Maybe they're the links to that. And I also do agree that all of us learned when we were on this committee, looking at the issue of domestic minor sex trafficking in the United States, that we didn't have any data in this. And so that is an important kind of way to help understand that. And we can talk more about how that's, in my own jurisdiction, that's been helpful with mandated reporting and sort of looking at the broader picture of how often it happens and who's involved.
So with that sort of perspective on what some of the overall goals, in large measure laudatory goals, what are some of the barriers and challenges, Tonya, that you've observed in implementing these mandated reporting laws, particularly for human trafficking?
As Jonathan sort of alluded to, sometimes people don't necessarily know what they're mandated reporters for. And I can speak from my own jurisdiction of California, where they did change the law to explicitly have law written around minor sex trafficking be a mandated reporting event that's reportable to child welfare. And that changed in 2014, I believe. But I can tell you many providers are not even aware that that's in their jurisdiction now. So that's where the educational component needs to come into play. I think one of the harder things from the healthcare perspective, and this comes from sort of what we know about child abuse and mandated reporting, or even domestic violence and mandated reporting, or sexual assault and mandated reporting, is that there aren't a lot of, there's not a lot of research to really show, does mandated reporting actually show good outcomes? There's been some research in that in child abuse, but with the broader area, and from what I understand, there hasn't been any research on these laws in human trafficking. And I think we need to know that, because in healthcare, we want to follow the best evidence of doing something that's going to be, have a good outcome. And so that would help shape that if we had more of that research. And this is some anecdotal, because again, we don't have a lot of research in this area, but I can say anecdotally of some of my young adult survivors, they have told me that they would not say anything because they knew that that might activate people knowing, or child welfare being involved, or law enforcement being involved. So that actually in some, and we know this with some other areas of mandated reporting, that it can actually be a deterrent on disclosure, which can then also in the area of sort of now with immigration issues, potential of abuse by a trafficker, or even in the past when survivors may end up in the criminal system because of disclosure, that can also be a deterrent, because they don't want people to know about what's going on. So they actually don't tell anybody, or basically lie about it, or they don't seek services because they're afraid of that of the mandated report being activated. And in my world of adolescence, it gets very tricky as one of the big kind of issues, and it's probably a question I get the most whenever I present on trafficking, is this balance in adolescence where we talk about confidentiality, and the information that young people are sharing with us is kept confidential. And that's done in the realm of trying to establish trust and ensuring that they'll want to come back for services. But this is an area where confidentiality, if information about being trafficked was disclosed, we would have to report this. So that gets into an issue about what information gets disclosed and what doesn't, and trying to maintain that confidentiality, either within a healthcare system, or within a practitioner, or even in how you're communicating with survivors. And I could talk a lot about medical records and the issues with that as well. I think one of the other things that more about this later on is the some of the historical biases and racial biases within the reporting agencies of child welfare and law enforcement. And that I know in my own institution, we're looking more at how child welfare CPS reports are generated, knowing that there's biases in those reports and biases within the system as well as individual providers. Again, we'll talk more about that, but that's something else that needs to be considered. Sometimes what the responding agencies may not always be trauma informed and always, following what are the needs of the person that the report's being made. And I sort of look at this as this power and control that's kind of what's going on with an individual who may be a survivor. And when that information gets disclosed, the mandated report sort of takes a life of its own. And you as a provider may not have control over how the information is shared and disclosed. And so that can lead to mistrust. I can tell you I've had patients, not want me to make a child welfare report, even though I knew I had to do that. And so it's balancing that. And my goal is not to have necessarily to make this report, it's to really have this young person engage in care and come back. But that may lead to mistrust if I have to, share information with other agencies. And then that can eventually lead to lack of follow-up, which can be an issue. I think another big concern can be sometimes safety of the provider and healthcare system, knowing that there could be retaliation by traffickers or other individuals who may be involved in the person's situation. And finally, I know this is a big issue, but it's one thing to have the mandated reporting policies in place, but it's another thing to really ensure that people are trained well in how to make a report, who they're referring to, and what the response is. And that's probably a bigger issue, that when these policies are sort of initiated, looking at how do we do more education of providers around these particular issues. And we can definitely get into that with questions and answers with the audience.
Gosh, Tonya, you've really outlined a pretty broad array of both, barriers and challenges, and those are serious considerations in how to implement mandatory reporting laws in a way that's going to be most beneficial for the young people or the individuals that they're really designed to protect. So do you have any further comments about that, Jonathan, from your perspective, from your legal perspective, what you see as some of the barriers and challenges?
Yeah, so I think Tonya mentioned many of them, and I won't repeat them. I'll build on one. I think that the training is important, and I know we'll talk more about training. The training of providers and mandatory reporters is important. The training of those who they might refer to is also important, because I know the providers, I'm a lawyer, not a physician, but the providers that I speak with have expressed concerns about, well, if when I refer someone, I may be referring them to a system that's overwhelmed, that isn't adequately trained to handle these types of cases. And so I think that's a potential challenge as well when we think about sort of who needs to relevant training. The lack of clarity, I agree. There's uncertainty. I'd mention two other things quickly. One is, and we'll talk more about this as well down the road. Most of these changes to expand mandatory reporting to include human trafficking have come with an unfunded mandate. And I think that's a real issue, because one of the things that one of my thoughts on this whole process is, in many instances, the harms or the physical manifestation of human trafficking may look similar to other types of harm that providers are already accustomed to identifying and reporting. They may see it as abuse and not label it trafficking. But so in some respects, expanding the definition of mandatory reporting to include human trafficking doesn't necessarily radically change what someone might do in an emergency department in the moment. But what it really provides is an opportunity to educate all mandatory reporters about the problem of human trafficking and how to respond effectively to it. And I think if that's one of the potential benefits, and these are all unfunded mandates, then we have a problem. You're just asking mandatory reporters to do a lot more, with no additional resources. So I think that's a huge challenge. And the last one I'll just footnote, and it'll probably come up later, is, you know, in a lot of laws on child abuse, 18 is the cutoff. And so there may be various services and protections and systems for children, but we know in the world of human trafficking, there are a lot of young people who are at that cusp. They may have just turned 18 or be 18 or 19 and may not have the same protections in place. So that's also a challenge.
Jonathan, from a legal perspective, do you have any thoughts about what the impact is of the reporting laws after a person has turned 18? In other words, if someone is 18 but discloses that they were trafficked before the age of 18 and they're still being trafficked now, would that trigger a report, or does that depend very specifically on the laws of a particular state?
Yeah, so it's jurisdiction specific, but that's a really good question. I'm not sure. I'm not sure whether that previous, the reporting would necessarily trigger in all jurisdictions that type of mandatory reporting response. But it's a great question, and I'm happy to sort of explore it further and share what I find.
Yeah, I mentioned
That's an important question.
It already turned up in the chat, and also I know it's a question that often does arise when people are, dealing with adolescents of varying ages that cross that 18th birthday line.
Yes, and I would just say, on the children effect that Tonya can probably speak to this better, but on the children effect, the other advantage is if you've turned 18, then maybe the 18-year-old doesn't have the worry of where does this have to be shared with others, and does it trigger a mandatory reporting? Maybe Tonya wants to speak to that.
No, and actually I've had a couple of patients recently who are young adults crossing that birthday line, and you're not a mandated reporter over 18. And that's only because I can talk with our net, about what's in place that we've created to sort of do a workaround for mandated reporting to sort of meet the needs of young people. And we do still can call child welfare up to 21 years of age, mostly just so they can run to see if the young person's been in the system, i.e. foster care system, which actually would help them with some resources like housing if they were a former foster care youth. So it's not a mandated report, but it's kind of a referral for to see if they are previously foster care involved. Also to help with so the CPS in our jurisdictions almost become a clearinghouse for how to get resources for older young adults into services if they need that through an agency that works here in San Francisco, as sort of an example. And we can talk more about that, but yeah, not a mandated reporter after 18.
That's a really important point, Tonya, and I want to just remind the participants on the webinar today that Tonya works in San Francisco, so some of the things that she will talk about are specific to either California law or San Francisco agency practice. And it's important that we all remember, as Jonathan pointed out at the beginning of the webinar, that these, not only do the laws vary from state to state, which they definitely do, but also the practices of various agencies vary from state to state and even from local community to local community. So I think Tonya's going to talk with us a fair amount about some of the ways in which some of the agencies in San Francisco have been able to respond, and that could potentially be inspiration or even a model for some other places. So let me turn to you, Tonya, and start with you and ask you to talk a little bit about how local agencies who are required to report can work with the responding agencies, in other words, Child Protective Services or law enforcement, to ensure that survivors of human trafficking actually receive the appropriate trauma-informed response when a mandated report is made?
Yeah, and I'll speak about my jurisdiction, but I know this probably is where some other people have seen similar issues. And previously in San Francisco and around some of the other Bay areas, with the area of like domestic minor sex trafficking or other human trafficking, the response actually was sometimes putting young people in juvenile hall. And we actually learned this because if they didn't know where to put a person, there was no housing or so forth, or there may have been other sort of overlapping types of crimes. And you could actually, there were child trafficking booking charges you could have in the past. So about, we started to learn within the last few decades that this is really something that should not be happening. We shouldn't be criminalizing people who are surviving this trauma. And so we now understand it as a form of child abuse or adult abuse in the case of—
Let me interrupt you just for a minute, because one of the participants has said that they're having a little bit of trouble hearing you, and I'm not sure if you can turn your volume up perhaps a little bit.
Let me see if that's any better.
Yes, I think it is.
So the issue of historically is survivors, it's been sort of a criminalization of how the responses have been. And so in trying to change the paradigm into it being more of a form of abuse, child abuse for under 18, where a lot of these mandated reporting requirements come into play, I think the response has always been sort of the default of child welfare and law enforcement, because those are the agencies that a mandated reporter has to report to. But I think a lot of us understand that that's not always the best agency for something like this to be responding. Talking about human trafficking offenses. And also the issue is with child welfare. I sort of look at them as an agency that makes sure children are safe in their home environment, or maybe they're making sure schools are safe, or daycares are safe. And this kind of goes out of that realm for them. So it's harder for them to necessarily respond to human trafficking because the person may be safe in their home environment, but they have these other things going on that are making them unsafe. So one of the things that I think has to be really examined within either CPS or law enforcement is they need to be part of the facilitator in how that coordinated response is going to happen, so that a young person is connected to the resources that they need, which may not be being in a safe home. It may be actually having housing because their home environment's not safe. They may need basic needs like just food. And those are not necessarily things that law enforcement and child welfare can always respond immediately or in long term. So what you're starting to see across the country, I think, is that child welfare, if they are the responding agency, has now been sort of linking to agencies that may work with runaway youth. And that's sort of what happened in San Francisco is our child welfare is connected with an agency that now does do that sort of long-term case management response, working with child welfare, but not necessarily being the lead agency in that response. And so as a healthcare provider, we now know that can be that workaround response. In other words, we may make a report to child welfare, but they will then, if they identify this as a person who may be involved in sex trafficking, be referred to the agency that will provide that appropriate long-term case management. So the bigger picture is child welfare and law enforcement, are they supposed to be the direct responding agency? And I think a lot of us understand that that's probably not that needs to be a more coordinated response with the organizations that work, within your local jurisdiction that can provide those appropriate services. And then also knowing that those services are trauma informed and are good referral systems, because sometimes the adult system isn't always going to match the needs of a youth and vice versa. I think any responding agency needs to be able to address immediate basic needs like housing and food. And I can say of the survivors I've been interacting with, particularly in this time of COVID, that's been the biggest issue, has been housing and having access to just the basic needs. I think the harder thing, the thing where child welfare sometimes works is because they are, quote, 24/7. And sometimes of the agencies that do provide services for survivors of human trafficking are not always 24/7. So that needs to be worked out. And that's kind of the example we have with the agency that we do refer a lot of our sex trafficking victims, called it's HEART, through Huckleberry Youth Programs here in San Francisco. They are now 24/7, and that took a lot of advocacy for that to happen, because sometimes it is 3 in the morning in the emergency department where this issue comes up, and child welfare can respond, but they may not be the effective responding agency for the young person's need. I think one of the other things with mandated reporting in general is, and this is where it sort of helps have this, but allowing the young person to have control of what happens with the report and what the response will be. And so it's really kind of becoming more survivor-centered, or in the world of clinical work, patient-centered, so that it's not just like we have to do this whether you want to or not. It's giving them a role in that process, as well as having those agencies understand that, and that, you know, even though a report may be generated and a person doesn't decline services, at least they're aware that those services are available. And I think that's one of the hard things around the mandated report is, I mean, the intention is to sort of, you know, obviously try to get a person connected with the services that they need. But at that moment, that person may not be ready to actually access those services. And so that's the understanding, and allowing that person to have sort of control over what happens with the report and the referrals that may be generated from that.
That actually raises an interesting point, Tonya, because one of the participants actually posed a question about what she or he referred to as the cycle of 8, you know, that it may take 6 or 8 times of trying to reach a person who has been victimized by trafficking before they're really ready to engage with services and be helped to exit from the trafficking situation. Have you observed that? Is that part of what you were referring to?
Exactly. Yeah. And I think if you think about it, that person, you know, how many times do you make a report? Do you do it each time they go to services when you know that they've been referred? So I think agencies that really work with survivors understand that it's, you know, sort of a harm reduction approach where when they're ready, they will access services, and they may access services for a period of time, especially if they're in crisis, like for housing or for food. And then they more stability, and then, you know, other things may happen again. So it's not like it's this one-stop thing. It can be this kind of process of, you know, getting someone into a stable situation. And the mandated report may be the way that sort of gets triggered, but it really needs to be looked at in sort of a holistic way of not just making this report to CPS and police, but really getting a person in connected to services that understand that this may not be the first time this happens, and then it may take a while. Again, then that allows the person sort of to have more control over what happens and when they're ready, and when they make that decision about trying to get themselves, you know, into more of a stable situation.
So, Jonathan, from a legal or a policy perspective, can you see any ways that we can sort of improve the likelihood that responding agencies and mandated reporters can be working together more effectively to actually ensure that trafficking survivors and victims receive the kinds of services they should be getting and that they need?
That's a big question, of course, but I mean, I think Tonya hit upon one of the critical pieces. Survivors have to be involved. I think when you're a service provider, you know, you don't always see how this operates from the perspective of a survivor, and there are often survivors need multiple services simultaneously, and they need those to be easily accessible. They need to be able to, you know, scheduling appointments can be challenging at times, so places need to have walk-in appointments often, and there are barriers in terms of fees for services. There's a host of different things. So I think critically, you know, we need to think about who's at the table, and survivors need to be at the table when whether it's an urban center or a rural area, figuring out how are they going to build an effective integrated response system. You do that by speaking with survivors and hearing sort of what is their experience and how have they navigated services and where have they found the barriers or the gaps. And I think that gives you a sort of roadmap of what you need to do. And then there's some hard work to be done in jurisdictions, right? I mean, I've been a part of conversations on data sharing agreements, and getting a data sharing agreement done can take a long time. And these are challenging issues because you're often dealing with entities and agencies that historically have very different work cultures, right? In the world of public health, which we all spend time in, transparency, public trust is really critical. In the law enforcement world, it makes sense at times not to be transparent. If you're in the middle of an investigation, you can't be transparent. And these are really challenging, different sort of strategies for approaching their own work. And each agency is responding to its own set of institutional incentives. So I think the other piece that we really need to think about is, in addition to sort of a survivor perspective, is what are the institutional incentives? What is the pressure on law enforcement? What is the pressure on healthcare providers? What within their institution? What are the incentives? What are they required to do that may be pulling them in a different direction from what might be needed? And there's a lot of hard work that needs to be done to build coalitions. And what Tonya and her colleagues are doing in San Francisco is amazing work, but I know that took a lot of effort to build and years. The same with others that I know in New York and other jurisdictions. It took a long time to build that, and people have to be in for the long haul. In the same way we talk about with survivors, somebody mentioned the cycle of 8. If you're expecting that somebody's going to say thank you for your help and this is great, you're in the wrong business, right? We have to be in it for the long haul and supporting and being available and letting young people have control over their process. So there's a lot of pieces in what I said, but I think, again, being survivor-centered, so we understand the barriers and what we need and understand how they navigate services, not just how we want to provide them, and then understanding incentives and how different agencies work, so you can start to sort of build collaborative processes. I think there's a lot of work to be done there.
And you said, you said just now, Jonathan, that Tonya and her colleagues in San Francisco are really doing terrific work, and I certainly agree with that, and that it took them a long time. It also, their efforts benefited from some funding that was appropriated at the state level. And you mentioned earlier in the webinar the whole problem of unfunded mandates. And so I think, it would be interesting if you had any further comment about sort of how critical is the funding piece in trying to achieve some of the things that you or Tonya have been describing.
Well, I'll speak briefly and then I'll let Tonya speak to her experience. Funding's critical, and I've worked with a lot of policy makers and had conversations over the years where they're very excited about doing something until you get to the conversation about money. And some, that requires, there are a lot of different strategies, but at the end of the day, if you're not willing to put any funding, what you're likely to have is a nice signing ceremony and not a lot of impact, right? And we have to do the work as advocates. And here I'm including everyone involved in this work has to make themselves heard. Hearing from, at the risk of being too self-critical, but they get tired of hearing from lawyers. And some, there may be people on the webinar who are also tired of hearing from lawyers. But it often is when a physician who works in an emergency department can come and say, this is what I'm seeing. This is what that funding would do. That's a much more powerful statement than having me report that. So I think, we need we need everyone to be advocates.
Put the white coat on and walk right over to the legislature. And
well, I would like to say, because what did happen came from attorneys in California, and it was really guided by the lawyers from the National Center for Youth Law in California, who I understood after I attended my first meeting, they met and said they read the IOM report, and that's what shaped that policy around allowing in California counties to opt in and developing, and it was focused primarily on sex trafficking. It incorporated the mandated reporting requirement law to be changed, but it also allows counties to develop their own county protocol, which many of the Bay Area counties have adopted. And it did come with funding, and it was a whole, I don't know the whole algorithm, and each county was allowed to choose who their lead agency was to lead this, but they had required agencies that had to be participating in the protocol development. I know in Alameda County, where they did a whole initiative, it was run through the DA's office. In my county, it happened to be the child welfare that ran it. But you had to have the agencies that were often involved, not just child welfare and law enforcement, but juvenile probation, public health department. That's how a lot of us got involved, to really look at how this happened. And that's how we created in our county, and other counties are doing different things, this system of a workaround for mandated reporting, so that you now basically child welfare is sort of the data entry. A mandated reporter will call child welfare, but they will then initiate this link to an agency that's much more appropriate for responding. And there's other counties that are doing other creative things, and we're all learning from each other as this, whole initiative has gone on. And I think it is a model, but it did come, and I'll just, it's one of our resources, the National Center for Youth Law, and how they helped shape this and create this within the state of California. And of course, it took years of advocacy and going through the legislative, sausage making to make it happen. But the key things it's a dynamic process. So even though protocols were established within counties, there's an ongoing process to see what's working and what's not, because even when you're working in one local jurisdiction, this is a broader problem. And I'll just bring this up now. One of the issues is, we may identify a young person in San Francisco, but they live in another county. How do you get services, and which child welfare do you report to? So that's another kind of issue. I didn't really bring that up, but because all the Bay Area counties are working together on this, the right hand is sort of talking to the left hand. Even though one child welfare may be the agency that identifies one or is responding, they can then refer to other counties that have, other non-governmental agencies that have resources for survivors. And that's a nice thing that's happening due to this law and how these protocols have been developed within each county.
So we've heard from both of you some really significant background and information about the challenges of mandated reporting and how to implement it, about the goals and some of the good practices. And I'm going to shift gears just for a minute, because a lot of the work that you're describing and a lot of the laws that have been enacted by states to incorporate human trafficking into their mandated reporting requirements occurred prior to what we have all been experiencing this year, which is this COVID-19 pandemic. And so I'm wondering, first of all, let's start with you, Jonathan. How has COVID-19 affected the landscape of mandatory reporting for human trafficking from your perspective? And do you think any of those effects are likely to persist beyond whatever miraculous point in the future the pandemic is more or less under control?
So COVID, as with every other issue, COVID-19 has had a huge impact. It's exacerbated inequities and heightened vulnerability of millions of individuals. And so on that alone, that sort of general broad-based harm, that has a significant impact in this space and potentially on mandatory reporting. A lot of people focused early on online exploitation. That's often the issue in child trafficking that gets the lion's share of attention. And certainly there was an increase in the number of reports to the National Center on online exploitation, reports of potential online exploitation. So that has increased with children doing virtual schooling and spending more time. But I think that misses in some respects, while that is really important to address, it misses the bigger picture. And the bigger picture is we have a real housing crisis and a jobs crisis on our hands, right? So there was a report a few weeks back, maybe more than a few weeks, I've lost track of time at this point in the crisis in the pandemic, but where 8 million, the report was that 8 million people had been pushed into poverty, newly poor as a result of COVID. And that's in the space of 7 months, right now 8 months. We know that many people, a number of jurisdictions in response issued a moratorium on evictions, but we know that those did not apply to all individuals, and many of them are sort of winding down, and so people are going to face months of rent coming due, and they may have lost their job, and families are being pushed into really frightening situations, and that might result in, among other people, young people on the street, more young people on the street. And we know time on the street, homelessness is a risk factor for trafficking. As we also know that child maltreatment, history of child maltreatment is a risk factor. And there again, we have at least anecdotal evidence that child maltreatment has increased during the pandemic. It's a little bit unclear because reporting has gone down in many jurisdictions, but reporting has gone down primarily because the mandatory reporters who typically reported or were a significant share of the reporting, teachers, pediatricians, are seeing kids less often. One of the things that a number of hospitals across the country have reported, while reports are going down, they're seeing an increase of kids presenting with abuse-related injuries. So I think the evidence suggests that child maltreatment is on the increase, and that's a risk factor. Time on the street may well be increasing or about to increase, and that's also a risk factor. So that puts a lot more people potentially at risk of trafficking. In terms of what the long-term implications are, yes, at some point when we sort of get the pandemic under better control, I think that doesn't resolve the issue, right? The housing, the fact that 8 million people are now in poverty who weren't, 8 months ago, they're not going, just because vaccine distribution finally gets there, or other public health protocols work to reduce prevalence, that doesn't mean they will magically climb out of poverty. So that vulnerability, that heightened vulnerability, is still going to be there for a significant period of time unless we put resources and energy into addressing that vulnerability.
Yeah, that pretty sobering comments here, but I think very much to the point. Tonya, do you have additional reflections about, from your perspective about the impact of COVID?
Yeah, I think the hardest thing is not so much making a report, because child welfare and law enforcement are still kind of working the same. And actually, child welfare is still going to people's homes and so forth. But the other ways that the services for those who may be needing services have really kind of gone virtual. And so unfortunately for a lot of young people, or young people who are unhoused or at risk or have been involved, access to phones is just an issue. So you can't necessarily communicate as easily for those agencies that may not be open, and the doors aren't as drop-in as they were before. I know, in the survivors that I've been interacting with since COVID, being able to meet them where they need, because I have a schedule and they sometimes aren't, available on certain times. Some of our own, safety net clinics have been shut down during this time. So access to care and drop-in care has been severely limited. And as Jonathan mentioned, that's, where young people may be getting services that are not as easily available. And then again, because of the economy and what's happening, unfortunately, I know anecdotally that, young people are going to some more survival type situations in order to get food and housing as the economy, worsens and housing becomes more of an issue. That's been the biggest issue right now, is finding housing for those people who need it as they are case managed into their various situations. And sometimes, unfortunately, that may lead to them moving out of the area where they are. I think COVID I think some of us know COVID's actually having a huge demographic shift right now, so that people are living in areas where it's more affordable, but they may not have the resources that they had in their primary home environment. So I'm seeing a little bit of that as well during this COVID time.
Thank you, Tonya. And I want to mention to folks, in case you're not looking at the chat right now, that HEAL has a curated list of COVID trafficking related resources, and that's on HEAL Trafficking's website under COVID-19 resources. So please feel free to avail yourself of those as well. Turning from one difficult and challenging topic to another, you had referenced this a little bit earlier, Tonya, but let me ask you now, what role do you see racism playing in this, mandated reporting arena, and particularly related to human trafficking?
Yeah, so I think I know in my own institution and my own department, this has been a very important issue that has been needed to be discussed for a while. The healthcare systems and even in academic centers where I am, we know that there's historical precedents for sort of institutional racism and racial biases and how care is delivered. And there's more and more that we're learning, just from the fact of the historical biases around how CPS reports are made. A mandated reporter makes a report and what is the decision tree in that. I think there's the assumption with mandated reporting that, we're all unbiased in how this happens, but I think the reality is we know that that's not the case. And I think there's more and more research coming out sort of looking at healthcare professionals explicitly in their own explicit implicit biases on how mandated reports are made. And there's a wonderful research that's done by Tiffany Johnson that's sort of looking at some of that, which can lead to how there's disparities in reports that are made, as well as disparities in which children, particularly we know children of color, are primarily removed more. So this kind of historical precedence, and I know because I did my training at San Francisco General in the early 90s, which was the, sort of during the whole crack cocaine, and complicit in that process of, who was being drug tested during pregnancy, who was being, which infants were being removed from their parents and so forth. And with that, I think it sets up this sort of mistrust of being someone who is a mandated reporter and how that process happens and when it happens, and that there are biases and there may be perceived biases, and there is a lot of mistrust in the responding agencies. I mean, another responding agency that we could talk 2 hours about is, the law enforcement and how they respond, and sort of understanding the biases in that, and that it can lead to sort of this long-term sort of children who are in the foster care system, the issues with that and the biases around that. And I know because I do care for a lot of foster care youth who are unfortunately primarily young people of color. So I think when we're looking at mandated reporting, we need to kind of recognize that there are some systemic and institutional racism within the institutions. One of the things that we're trying to do is actually, as a quality improvement project within my own institution, is really looking at the data of what CPS reports are made on who and when and why, and really examining the sort of trying to understand the biases that may play in that, as well as trying to understand what are the processes after a CPS report's made. And I think that's one of the things in healthcare where we don't know that would be helpful, is having more of a communication with child welfare about what happens when a report's made, so that we're really doing what we want to do and do no harm, but understanding that there may be explicit and, more importantly, implicit biases in how that happens.
So, Jonathan, do you have additional thoughts about the role of racism, which is such a challenging issue and such a critically important one at this time?
Yeah, really, really important. I'm glad you brought it up. I would echo what Tonya said about the sort of embedded, both implicit and sometimes explicit bias in the mandatory reporting processes, not just healthcare, but we see it in law enforcement, we see it in school in terms of discipline in school and reporting. But it also operates in the world of human trafficking separate from mandatory reporting. So there's almost sort of a double whammy in a sense, because we know in the past 20 years of sort of significant effort, renewed effort to address human trafficking, there has over and over been this sort of quintessential victim being a young white girl who's a victim of sex trafficking. And while that certainly happens, we know that's led in many instances to overlooking kids of color, boys, trans youth, gender nonconforming youth, all of these populations that are often at heightened risk are overlooked in identifying cases of trafficking, or identifying those who may be at risk where we've missed opportunities to intervene and provide support before harm occurs. And we see that with systems involved, children who are also at heightened risk. Boys who have spent time in the juvenile justice system have a hard time convincing anyone they've been victimized by human trafficking. And again, it goes, all that builds on implicit and sometimes explicit bias. So it's the bias operating in the world of human trafficking and the bias that's operating in the mandatory reporting processes with the backdrop of broader societal biases and racism that present some real challenging problems for successfully and equitably identifying and assisting young people.
Do you want to say a little bit more about what you just mentioned, Jonathan, with respect to trans youth, gender nonconforming youth, boys, sort of the biases that may be operating with respect to them, what we can do about that, what role does that kind of bias play, and how can we address it?
Yeah, so I think, I think we've made some improvements in the world of human trafficking, but I think for a long time, boys were not on the radar at all. Trans and gender nonconforming youth were not on the radar at all. We see this often in shelters that are set up specifically for survivors of human trafficking. The vast majority of them still accept only girls. So boys have fewer specialized shelters to go to. Trans and gender nonconforming youth may have even fewer. So that's one place where we could readily, and I say readily, I'm not suggesting it's easy, but an obvious place where there's where people in need, young people in need, are not able to access services just because of who they are, right? And so I think that's one place. I think there, as I said, I think there's been some improvements, but again, a lot of the law and policy focuses very much on sex trafficking of girls. And that's still a legacy of the early years where overwhelmingly that was the focus. There's more attention now to labor trafficking, and there's more attention to the fact that boys are exploited in human trafficking, and trans nonconforming youth are also exploited. But we have a long way to go, and I think that requires challenging policies and making sure that they are inclusive. Too often that's not happening.
Yeah, thank you for that. And Tonya, I'm wondering if you have some comments about this, because I know that a lot of the sort of initial work in California really was focused more on sex trafficking than on labor trafficking. And so I'm wondering if that's evolving at all, and if there was a bias sort of in favor or focus more exclusively on girls, or whether you've seen that expanding. Of course, California and San Francisco Bay Area is a place where in some ways there's a more inclusive opportunity to address the needs of a variety of youth, but I'm curious what you've seen in terms of an evolution there in the California environment.
As a question, so there's a lot of assumptions even about the Bay Francisco, because some of the most unhoused people in San Francisco are, gender nonconforming or young men, and that's unfortunate. Even though there's resources that are available, COVID, of course, has exacerbated that significantly. And I think that lends itself to like where the money goes for the resources, and that's where advocacy has to come in, knowing that there are gender nonconforming or trans youth who may be engaged in a lot of survival sex, but don't have access to the same services that maybe a girl who's been trafficked. And so they're looking at that. There has been more of a push. I don't think it was the intention of the original law in California when it came out to sort of invite counties to be part of the development of protocols on minor sex trafficking. But I think there is more of an understanding that we need to look at all human trafficking. So before COVID, there was more discussion of how can we reach out, not necessarily from a mandated reporting perspective, but how can we work a system from these protocols that have been established to expand to include labor trafficking and maybe focusing more on adults as well. The issue, of course, they're not a one size fits all, and there are different populations. I think we all know labor trafficking sometimes involves more immigrants and people who may have immigration issues that are separate. So how to connect services to the populations that may be involved in other forms of human trafficking can be more challenging. Also, we were able to create a 24/7 sort of system in the Bay Area and San Francisco. That may not be as easy for other forms of human trafficking like labor trafficking, but those issues still may need a 24/7 response. So, but there is a lot of discussion of sort of expanding that. I think it's nice to sort of develop sort of a wheel in a way so that another wheel doesn't have to be reinvented, but kind of expanding on that. And I think, if people are looking at what we're talking about today and how to create something, starting small and then sort of expanding from that can sometimes work. But then also, I find just being at the table when discussions around how programs and policies are being implemented, it's important as a healthcare person to sort of bring in that perspective so that the other people that are making these decisions kind of have a perspective of what the needs are. And from my world of being a healthcare provider, that, you have the ED doc that has someone and they need to know where to send a person at 3 a.m, not 9 to 5 on Monday to Friday. So those are where those things can come into play. For those of you who are interested in sort of developing or working within your own community to sort of establish things for all survivors of human trafficking.
So that's a great segue. A couple of our participants have raised questions about how to really get survivors an opportunity to be more engaged with child welfare in a sort of policy making or program defining way. And that's something that you may have done more of in San Francisco than possibly in some other jurisdictions. But do you have any advice for how to kind of take that up in other communities and move it forward, and keeping in mind particularly that, as one of the participants mentioned, sometimes reporting either to Child Protective Services or to law enforcement actually results in harm to survivors. So engaging survivors in how to ensure that they not be harmed as a result of a system that's designed to help them is a really critical component. So I don't know if you have any advice or thoughts about that, Tonya.
In a way, it actually kind of involves sort of that restorative justice idea of having young people be involved in how these policies and procedures and protocols are all implemented and created. And so that's been part of the initiative that happened in California, as well as at the local level. There's the San Francisco Collaborative Against Human Trafficking has been very involved for a while. They were the ones that sort of helped advocate
to create sort of the heart services that would be the responding agency instead of child welfare for when, a person was identified and reported to child welfare. They are also the ones that looked at it, and survivors were like, yeah, this is an agency that should be doing this. And Huckleberry Youth Programs is, I'm sure there's other places in the country that have similar kind of places where youth who are runaway go to. They're kind of that low-hanging fruit of an agency that knows how to do this already. And having those people who've been involved in those institutions be at the table to really either they themselves by proxy express what's going on and what the real life issues are of survivors, or being able to have a survivor actually be there and be part of that process can be a really kind of like, again, restorative justice process of like, these are how these laws need to change and this is why these need to change. So that, that informs more of how policy should be written to really incorporate that. And it does, I think, always require training and money, but sometimes it's really just thinking outside the box of there's agencies out there that are doing great work, but they're just not connected with the law enforcement child welfare systems right now and sort of linking those together. And sometimes it's just creating the meetings that happen. I know I didn't know people at child welfare. I didn't know people in law enforcement as well as I do now. I do from my sexual assault examiner world, but it's been escalated in a lot of great ways because I have these relationships now so that I know who to call, like if something's not working with our protocol. We need to have a meeting about this because this is falling through the cracks, or this is, whatever. And that's how these systems just become better at being that kind of system of a response that really meets the needs of trafficking survivors, as well as, I'm speaking like what I know from what my survivors I've learned that I've done things wrong or right, or how things haven't worked or worked, but them being able to really be at the table and be part of that discussion, I think, is invaluable.
So Jonathan, you've done a lot of advising of policymakers and NGOs and other groups. Can you think of ways that we could really sort of incentivize these, decision makers to take seriously the need to engage with survivors, not just in a token way, but in a really sort of meaningful, systematic way?
I think one of the things that we can do is we can elevate survivors, right? So if we recognize that and elevate them in positions of leadership, and so it's not just survivor-led organizations having to start their own NGO, which those organizations are important, but within the organizations that aren't run by survivors, there should be survivors in leadership positions there. I think there's a mindset shift that needs to occur among a lot of policymakers. And the sort of classic example I've seen many times over at various state and federal briefings and hearings is today we'll hear from 3 experts and a survivor on a hearing on trafficking, and that drives me mad, right? That's 4 experts,
right.
But they're not seeing that. And so part of what might help overcome that is if we in the anti-trafficking community elevate survivors, we let them take the leadership so that policymakers are forced to see them as leaders in the field. I would be simply repeating everything that Tonya said, so I won't do that, but I might repeat a little. It's so critical. Who's at the table matters so much. Survivors have to be at the table, and all the other relevant agencies need to be there, and local communities need to be there. And I think it's okay to just be there initially, right? If they don't have the resources, if they can't do everything that's on the wish list right away, continuing to include them is really critical because, they will learn, we will together figure out ways to sort of harness some resources. So I think that's really important, to sort of who's at the table. Cultural humility is really key in that part. And again, survivor leadership and survivor sort of recognizing the expertise of survivors is so valuable. As part of that, I would also include not just survivors, but at-risk youth. In other spaces beyond trafficking, in my other children's rights work, I've seen a lot of examples where young people are not consulted, and then the intervention is useless because, and that can be answered by young people within 30 seconds. So of course we wouldn't use that. It's not relevant to where our lives are, right? So I think we really need to engage young people.
So this has been really a terrific conversation so far, and I'm seeing some additional questions coming up in the chat, which I'm going to try to incorporate into our conversation, and also to remind participants that if you do have questions you'd like the panelists to address, please do enter them in the chat, and I'll keep an eye on that. One question that's arisen, and I'm going to start with you on this one, Jonathan, is something that really is a perennial question, and that is undocumented individuals may, often avoid seeking care out of fear of deportation. Does mandated reporting provide any kind of protection for this information, as far as you know? And I'm sure it may vary from state to state in terms of some of the specifics of the state laws, but as a general matter, what's your thinking about this?
So I can't speak to all jurisdictions, and here's where I should be inserting this does not constitute legal advice line. But the ones that I'm aware of, no, it does not. And I would expand what you identified as a significant problem, not only to include undocumented immigrants, but also citizens and lawful permanent residents who are in mixed status families, who may fear that even if I go, somehow a family member is going to be identified as an undocumented immigrant. And so I think it's a really significant issue. It has become, created, we've seen, real stress and anxiety and worry, justifiably so, in the last 4 years. I mean, we'll have to see how that plays out. In some respects, maybe there is, we talk about the need for resources, we talk about the need for action. This is an issue, human trafficking is an issue where policymakers on both sides of the aisle, so to speak, have offered support, have eventually gotten behind putting resources into this issue. So this may provide an opportunity where human trafficking provides the entry point for educating about why it's important for some immigration reform. That is admittedly perhaps an optimistic view, but I'm sticking with it.
Tonya, I'm sure you've encountered this issue in your practice.
Mm-hmm.
Do you have any additional perspectives?
Yeah, it doesn't pertain necessarily to mandated reporting, but linking survivors to services. They've gotten T visas and then access to, legal status, which was very helpful because of their trafficking experience. And I learned that through a patient. I didn't know that was even possible. And when I referred a particular patient, that's what happened. And I know that because suddenly she had Medi-Cal and was able to get more healthcare services because her status changed. So that can be sort of a positive thing in the circumstances of trafficking, is that they have access to sort of a legal status. And I think I can't speak, about other jurisdictions, but that can be sometimes a benefit that you as a provider or the person you're serving may not know that.
That's great. It would be wonderful if we could see that happening to more affected individuals, and perhaps I'll adopt Jonathan's affirmed optimism that may be a possibility in the coming.
To be clear, it comes with a heck of a lot of work on our part to make sure these things happen.
That's right.
But I think you have to be hopeful.
Yep. It takes a lot of lawyering.
And advocacy by the healthcare and communities, both. So one of our participants has mentioned that California program called California Pact, Preventing and Addressing Child Trafficking, that is funded by the state, has started to work with some counties around labor trafficking. So I wanted to highlight that comment because I think that is critical. And I think you mentioned at the beginning of the webinar, Jonathan, in your sort of framework comment, that some of the reporting laws do include both sex and labor trafficking, and some only include sex. And one kind of thing that I wonder about is there's often so much overlap and intersection between sex and labor trafficking. I mean, often people who are trafficked for labor are also sexually exploited, and there's a lot of overlap. Does either of you have a comment on specific things that we should be doing, either with respect to the mandated reporting laws or just in general with respect to sort of elevating some or trying to reach some parity between labor and sex and responses to those in the trafficking arena? I'll pick on you, Jonathan.
Yeah, so there's a lot in that question. I think that for what, you know, I think mandatory reporting laws are here to stay in the world of human trafficking, and though many states still have not expanded their definition to include human trafficking, I think they eventually will. And so I think that's going to happen. And so I think the question is not whether it should happen, but sort of how do we make it work well? And I think one of the critical pieces we've identified is funding. We have to push for state legislatures to include funding behind this mandate. I think we actually also need to have the legislation and the policy reflect that the importance of training, and training that is not just trauma informed, but is also tailored to specific sectors, right? The healthcare training should not be the same as what schools get. And it should not just be this, what we've all seen at various points, human trafficking 101 that leaves participants without any additional tools to make a difference, right? So we need training. Right now, most of the states that have expanded mandatory reporting to human trafficking have not mandated training for all mandatory reporters. Sometimes it's just law enforcement, sometimes it's just a suggestion, or they encourage training, but there's no mandate. There's also very little in the way in the legislation about evaluation. Tonya mentioned this earlier, we're not evaluating whether mandatory reporting is working, and equally important, if it's not working as we hope, where are the breakdowns and how do we actually address those? So evaluation is really critical, and we've got to make sure that's part of this process.
So one further question for you that's come up a couple of times, Jonathan, is when law enforcement receives a report and they've kind of cross-reported that to Child Protective Services, is there anything else that law enforcement should be tracking in these situations? And I realize that may vary depending on some specific statutory requirements, but sort of from a big picture perspective, beyond a handoff to Child Protective Services, what is the proper role for law enforcement?
Well, I think one of the things, so you're right, it varies across jurisdictions, but one of the things that's happened in selected jurisdictions is they've changed how they respond to at-risk youth in some really positive ways. Dallas Police Department did this some years ago, where they started to track those who have come into the system that may be at risk, may have had trafficking or similar exploitative experiences. And what they did was subsequently, if they're tracking, then subsequently, if any of those kids show up in the system, those kids are immediately redirected to someone within law enforcement who is specifically trained to work with young people who've been exploited in human trafficking, right? So that's one. I'm not suggesting it was easy to build it, but that's something that's doable for law enforcement, where even after what we see, and it was mentioned earlier, that some of these kids go back into the life and then they cycle in and out. So chances are, in many instances, law enforcement will run into these kids again. And what needs to happen, one of the things that can be positive in that moment is, if that happens again, if they're immediately referred to somebody who knows how to handle human trafficking and is adopting a trauma-informed approach to law enforcement, that has a much better chance of being a successful interaction with a young person than if they're just, cycled back through law enforcement. So I think that's one thing that's possible.
So we've got 2 more questions and only a few minutes. So I'm going to pose one question to each of you and see if we can cover them both. And I'll start with you again, Jonathan. If a survivor refuses services, particularly multiple times, how might that, or does it have any effect on the legal perception of their being affected by force, fraud, or coercion in later litigation, either against the survivor or the perpetrators? And this isn't specific to the reporting context, but it seems to be a slightly broader question.
Yes, I'm not sure I fully understand the question, but let me say a few things that hopefully get at some of it, right? So under federal law, a minor is a victim of human trafficking. That it doesn't change whether they have been identified on the 1st, 5th, 9th time, right? So that their status doesn't change in that regard. What does change, I think, potentially less legal, but more in terms of perception, is whether those that they interact with in the various systems that they connect with, perceive them as a victim or perceive them as somebody needing help, as opposed to somebody who has made a choice. And I think sometimes we conflate this idea that if somebody goes back into the life or goes back into an exploitative situation, that they've chosen that. And therefore, and we see things, particularly these days, in such a sort of binary way, right? You're either a victim / survivor, or you acted on your own, right? We see this in the same thing where trafficking often starts, particularly in the global context, with migration. Somebody migrating and they end up, and we say, well, they were a migrant, right? And I think that we need to understand that trafficking is complicated and complex, and just because someone hasn't immediately embraced services doesn't change their status. But federal law doesn't change their status, but it also shouldn't change the status in terms of those of us who interact with survivors and how we perceive them.
Thank you. And one more question for you, Tonya. If you, as a mandated reporter, if one of your patients has sort of begged you not to report their situation because they're afraid for their safety, and because of the legal requirements, you've had to report it anyway, and then the patient in some way has been harmed, how do you handle a situation like that? That's a really poignant, not legal, but a very, very clinical and question.
This comes up with all sorts of areas of mandated reporting, including just, sexual assault. And I think the best way to think about it is from a trauma-informed lens and the power and control, because now you have this information and you technically have to make this report. So always knowing that a person needs to be informed of what is confidential and not confidential when you're having that conversation with patients, because some things are not confidential and you have to make reports or let other people know about it for person safety. When that situation comes up, and it's very common that comes up, what I usually do in that situation is it's always important to know what the response will be. So I might talk to them about that. In the case of a trafficking victim, what I usually do is I let them be in part of the process. I go, I have to make this report, but we can tell them no information, we can tell them some information, and then I will also tell the responding agency, like, this person doesn't want anything done with it, and stop. What's been helpful, though, is to have a link to a service agency that can help this person if and when they want that. So it may just be a card and a phone number, like, here's what you can do down the road, just to try to get them to understand this is not because I want the police and CPS to come here now and like interview you. It's more that it's framing it in the sense that I care about your safety and I want you to be safe, but you have the control over what information we share and don't share in this situation. And I know we're running out of time, but that also gets into what you document in your medical chart and how you're putting things. So I really have, you know, survivors tell me what they want there and what they don't want there and what they want shared and not shared, because again, that's that power and control. And you want to be able to give someone those choices to say, no, I don't want these things done. But it's important to put that up front. And that's where when I give this sort of lecture to healthcare people, I say, this is where the homework comes in, where you need to find out what the response will be, because you don't want, you know, CPS coming in the middle of the night if they don't really need to be there and that person doesn't want to make the report themselves.
So this has been a fabulous conversation, and I really appreciate the thoughtful comments from both of you. We do need to wrap up, but I'm going to give each of you about 20 seconds to give a parting message, if you have one, to the assembled participants. I'll start with you, Tonya. Any takeaway that you really want people to remember?
Thanks, and I really do thank everybody for coming to the webinar or listening to it. I think we kind of highlighted a few of the things that moving forward sort of improve the current policies that are in place around mandatory reporting, as well as jurisdictions that may be thinking about doing something like this, that we do need more research to help supply the evidence to show where these laws work and where sort of the holes are to improve them. And I think one of the key things in doing research is also involving survivors in that work, or involving them in the policies as they're implemented, to sort of help shape how they actually do impact survivors, so that it's not doing any more harm. And I think from the healthcare perspective, it's important, you know, as we highlighted too, that training needs to happen, not just on the laws, but how to really effectively link survivors to services, you know, knowing that they may be coming in again and again and again, and again, having survivors be involved in those kind of healthcare system policies when they are being implemented. And I think sometimes too, with healthcare providers, we get in this yes, no, or we have to, we don't have to, but there is an area of clinical judgment. I know for myself, when I get in this situation, I think someone asked on the call, on the chat box around, like, what do you do when the person doesn't want you to make that report? You can sort of empower them back to have them decide what they want to do with the report, knowing that the overall goal is to really help link them to services when and if they are ready to do that. So I think that's an important thing sort of from the healthcare perspective to take into consideration.
Thanks very much, Tonya. And Jonathan, do you have any final words for the participants?
Thank you, Abigail. And I also want to thank Heal Trafficking, and thank you, Abigail, for organizing this. This has been a really wonderful discussion, I think. I have a couple of thoughts. One is, I would echo what Tonya said, that survivors have to be not just involved, but at the forefront of what we're doing here. And then also at-risk youth as well. For those focused on child trafficking, young people need to be part of this process as well and be given the opportunity to play a meaningful role in developing programs and policies. For those who are mandatory reporters on the call, and I suspect there are a number of them, I encourage you to make your voices heard in the policy arena. This has been a good example. We have a lawyer and a physician today. And so this is an opportunity, one of many opportunities, to understand each other's perspectives better, learn from each other, draw on expertise across all disciplines. And we need more of that, because ultimately what we need is a comprehensive integrated response to trafficking. So as part of that, I really urge mandatory reporters, healthcare professionals, school personnel, and others to get involved in the policy arena, either directly or indirectly. Mandatory reporting is here to stay, and it's likely that more states will expand their mandatory reporting to include human trafficking. So we need to make sure we get this right. That means ensuring that resources are allocated, and these aren't unfunded mandates. That means effective training, and that means evaluation, among other things. So I'm sure it means many more things, and that's why we need to hear from you. Thank you.
Thank you, Jonathan and Tonya, for those very thoughtful closing remarks, and of course for your participation throughout this webinar. I would also like to thank Heal Trafficking for making this forum available for the webinar this afternoon, and to bring to your attention that there are several resources which are listed on the slide at the present time. The Heal Trafficking Protocol, which is one of the resources listed, does include a section on developing protocols for incorporating mandatory reporting requirements into your organization's protocol for human trafficking. There are other resources listed as well, and the resources will be available to you through the recording of this webinar, which will be posted within a few days and announced on the Heal listserv at the time. I am so appreciative of everyone's comments this afternoon, of your attention, of the excellent questions that you asked in the chat and that we tried to get to in the discussion. And a final thank you to Jonathan and Tonya for participating as panelists in this webinar today. Thanks very much.